Hi everyone, thank you all for joining. Um, seeing who's on the call. We'll go ahead and get started. Thank you everyone for joining today, and welcome to the CIN webinar, Creating Equitable Health Outcomes Through Building Internal Diversity, Equity, Inclusion, or DEI practices. During today's presentation, you will hear from Homeless Prenatal Program, which is a CIN partner organization, and their past, present, and future DEI work. Their presentation will showcase how improving internal DEI practices can create more equitable health outcomes. And there will be time at the end for discussion with our speakers, so I encourage you all to think about questions you may have as you listen in. I'd like to start by first giving a brief overview of the California Improvement Network. My name is Lauren Forsell, and I'm the Program Manager for the California Improvement Network, also known as CIN. CIN is a learning and action community that advances equitable healthcare experiences and outcomes for Californians through cross-sector connections, spreading good ideas, and implementing improvements. CIN is a program of the California Healthcare Foundation and managed by Health Force Center at UCSF. You can learn more by visiting both of our websites. A quick note about some tech tips for the Zoom meeting today. Everyone is on mute except for our speakers. If you are having any tech issues, please message my colleague Marie Hubbard directly, and she will help answer any questions or issues that you may run into. And now I'd like to briefly introduce our speakers and kick off today's discussion. Like I mentioned earlier, this webinar will be a presentation, so please feel free to put questions in the chat as they come up, and we will address them during the Q&A session after the presentation concludes. So I'd like to introduce our speakers now. We have two incredible speakers from Homeless Prenatal Program. We have Woldemariam, who's the Director of Programs for Family and Wellness, and Liz Ruggieri, who's the Associate Director of Evaluation and Implementation at Homeless Prenatal Program. So I will pass it over to them to get the presentation started.
Awesome. Thank you, Lauren. We are going to get started. Liz is going to be sharing her screen. Second. Okay, thank you so much for being here. We are super excited to share a little bit about our agency and our work. But first, want to just thank you all for being here. And as you all know, people are devastated by what's happening with the fires. We absolutely send our thoughts, and we are thinking about you and wishing you the best. And just know that we are here for any support you may need. And so just thinking about you because we know we have partners all around. So if you are here with us, thank you for coming. Next slide. So before we talk a little bit about our agenda, I just want to say that we know that there are many factors to achieving equitable health outcomes. We believe that examining DEI practices internally is key to providing the best care possible when working with families, and especially the families that walk into our doors. We have dedicated time and resources to examining our internal practices, and we are excited to share a little bit about that journey with you today. So for today, this is what our agenda would look like. We will talk about our agency, HPP, Homeless Prenatal Program, talk a little bit about our DI history and timeline, what our approaches and findings have been, share with you the actions, initiatives we have taken, and discuss some successes and challenges. And we will have some time for Q&A. Okay, so the Homeless Prenatal Program was founded in 1989 and has become the cornerstone for families in San Francisco, with a focus on empowering low-income families, particularly mothers motivated by pregnancy and parenthood. The mission and vision of the Homeless Prenatal Program is that it aims to provide comprehensive support to families, ensuring stability, health, self-sufficiency, through holistic approaches that integrates crisis mitigation, stabilization, and advocacy. And we hope and we know that if we do our programming really well, these will be positive outcomes. And so the program outcomes are healthy babies. For healthy babies, it is prenatal services to promote healthy pregnancy, birth, and bonding. For safe, stable housing is housing support, including education, resources, and rental assistance. For nurturing relationships is services designated to strengthening families and protective factors. For economic stability, it is job trainings, financial education, and other resources to encourage family stability and self-sufficiency. So who do we serve? HPP, the staff of over 130. We serve 3,500 to 4,000 families annually. 100% of the families live in San Francisco and are considered low income. 70% are pregnant or have children 0 to 5. 40% are experiencing homelessness, and 50% speak a primary language other than English. The services range from basic needs to intensive case management, therapeutic services, wellness services that brings lots of joy, education, support, and housing resources for families who are needing to move into permanent housing, for families that need deposit, and for pregnant moms who need a place to live. We have a transitional housing that they get to live in for the duration of their pregnancy and for a year postpartum. And they do not leave this transitional housing until they have some kind of stable housing to move into. Next slide. So transitioning a little bit into our DEI history and timeline. And so our journey actually started way back in 2013. And this started as a community meeting. And the community meeting was in response to what was happening to the events in our community and also nationally. Our staff were being impacted by what was happening in their community and also what they were watching. And they were coming in to try to provide support and resources for families, but they were struggling themselves. And decided that having a space where staff can come and check in with each other and support each other was a way to start. So we did that for several years. And that transitioned into open equity work groups. And the equity work group was a monthly work group, and whoever wanted to attend can attend. It was led by a couple of our senior leadership team members. And it was a space for, obviously, to share what's happening and to ask for support and to provide support. But it was also a start of what it means to learn about what the work of equity is, how we provide equitable work, and how do we learn that together. And so we did that for several years. Until 2020. And I think with the murder of George Floyd and what every agency was going through and examining their own practices, we were no different. And we realized at that time, actually, we couldn't do this on our own, that we needed a consultant to support us and guide us through this journey. And so we hired a consultant, Relac, who was able to help us map our racial equity journey. And through that, and we'll talk about that in a little bit, but through that, we were able to create priorities for the agency. By we, I mean the staff of the agency with the support of our consultant. And the three priority areas were racial healing, shared decision making, and distributed leadership. And with that, a task force was created. And the task force's responsibility was to help guide some of the work. And we will talk about that in a little bit. And we did that for several years, did a lot of data reviews, created some initiatives. One of the initiatives was Black Client Experience. And did that for several years and got to the point where we needed to see how are we doing, what are our staff saying, and we need to do more listening sessions at this point because it had been several years. And we recently hired another consultant, Joy Channel, to help us and listen to our staff and by doing listening sessions and listening surveys. And we are still waiting for results of those. Next. Next slide.
Button.
Thank you, Liz.
There we go. So we want to focus today a little, sorry, not letting me go back on the second half of this timeline and dig more into this work with you all. So thank you, Eden, for setting up the context so beautifully. And first, we wanted to speak a little bit more to the agency priorities and the work that we did with our consultants, RELAC, and how that's impacted the work that we're still doing today. So Eden alluded to the racial equity mapping that we did together, facilitated by our consultant. And what that process looked like was a series of interviews and surveys for staff so that we could understand what we were already doing pretty well and where there were gaps in our understanding and implementation of equity work. And after we got the results of that mapping, that really supported us in kind of narrowing down the scope of what we actually felt like we could accomplish, since there's so much to do. And we landed on the 3 agency priorities that Eden mentioned: promote healing, shared decision-making, and distributed leadership. And we're still working on those today. RELAC also recommended that we identify an equity task force so that there was a group who could hold this work and move it forward. Just feeling like if we didn't really resource this work appropriately, it wouldn't get done. So that's what we did. And the equity task force is that work group. They formed in early 2021. They are still going strong. They meet bi-weekly with the goal of developing specific action plans and implementing initiatives related to those 3 agency priorities. This is staff-led. It consists of about 15 members from all different agency departments. Folks serve for 2-year terms, and there is an equitable selection process. It's essentially a lottery for anyone who wants to join. And we always make sure that we are incorporating staff from all different areas of the agency, including several folks from direct service, a few from management, and at least 1 executive team member. And the way this group runs is through practicing this shared decision-making and distributed leadership. So kind of like working out, what does that model even look like? They started doing in 2021 with rotating facilitation and leadership of that group. And I want to talk now, kind of talked about what happened that got us here, the development of the equity task force. And I want to talk a little bit about what our approach to the work was after we established, like, here are our priorities and here's how we're going to do it. So the first thing we realized we had to do was just really gather information. And we did that in 2 ways. The first was reviews of the data around where we thought there might be disparities in services or outcomes. And we actually found at first that services were being provided pretty equitably. And what I mean by that is everybody who came in requesting a referral typically got it. The time from receiving a referral to receiving the services didn't really differ across different groups of clients, and people were spending pretty equal amounts of time with their case managers. So that was really positive. However, despite that kind of positive note of services, we did find racial disparities in client outcomes that we will touch on a little bit more later. The second thing we did to gather information was facilitate different spaces where we could really hear what was going on anecdotally and qualitatively from clients, staff, and community partners. So we established those spaces where we could hear what was going on for people, see what they thought of HPP's service provision and where we might be kind of missing the mark on equity practices, and get recommendations from them. And once we were able to gather this information, we jumped to the planning stage. So developing specific policies and practices that we felt might mitigate the disparities that we're seeing and hearing about, and just in general, facilitating a better experience for every client, every family who came to HPP. There were a few different areas where this work was done, but the majority of it was done in that equity work group where people had dedicated time to be doing that work. Since everyone also is doing their full-time jobs, and this was something new that we were adding. And then finally, after the equity task force was able to develop those policies and practices, we just focused on implementing them. We started with larger kind of agency-wide policies to set the foundation for the work, and we'll talk about that in a little bit as well. And before we move on to that, we did want to go through some of the findings that we alluded to, and where we typically found that there were disparities in what was going on with our families were in the areas of housing and pregnancy, which I would doubt is a surprise to anybody here. So housing first, we found that Black families who came to HPP were requesting housing support at their intake significantly more often than non-Black families. So about 80% of Black families who came through the door came specifically looking for housing support, compared to about maybe 50% of non-Black families. And we also saw that Black families were reporting higher rates of homelessness at intake. So about half of Black families who came to HPP on their first day with us told us that they were homeless, compared to maybe 35 to 38% of non-Black families. So already there's something here, because we can see the disparities in who is stably housed in San Francisco just at the point where folks are coming through our door. So after that, we looked back in time and started tracking trends, and we saw that the percentage of Black and African American families who reported being homeless at intake actually increased from about 45% in 2018, maybe 55% in 2023. It did dip back down to about 50% in 2024, which is great, but we'll see where that trend goes. So we're keeping a close eye on that. And then the second area is pregnancy. And we know that, I'm sure everybody here as well knows, that there are significant disparities in maternal health that persist across the country, specifically for Black women. And we do see those disparities reflected in our client population at HPP. So we just felt that it's important to name it. And this also is impacting a lot of the work that we're doing now. So to just kind of set the stage. To review some of these things, we look at a lot of metrics for pregnancy and labor and delivery. So we put a few of the most, what we feel are the most important ones here. And what we found was that about 1/3 of our Black and African American families reported having a high-risk pregnancy, compared to about 17% of all clients. We found that 84% of Black families were reporting that when they had their baby was at a healthy birth weight, compared to 90% of clients. About 11% of Black families reported having a preterm birth, compared to 9% of all clients. We saw that inductions were very high. Induced labor was very high across all races and ethnicities, which is something we're still talking a lot today. But even here, there's a bit of a disparity, with 38% of clients on average reporting an induced labor, but 44% of Black families reporting an induced labor. And then finally, we saw that about 1/3 of Black families reported some birth complication to us, compared to an average of 26% for all clients. These numbers are all averaged over about the last 3 or so years. Just so you know. And when we look at this, some of these differences in the data between what's happening for Black families and non-Black families are more significant than others. So, obviously there's a bigger difference here in high-risk pregnancies than there is for preterm births. 9 to 11% is not all that different. But when we look at this holistically, we see Black and African American families reporting on average more high-risk pregnancies, lower birth weights, more preterm births, inductions, and birth complications than their non-Black counterparts at HPP, which in itself says something really significant, and is a pretty clear statement in support of this larger body of evidence that we're seeing around disparities in maternal health outcomes. So this was really pivotal to us. And what this also meant was, even if we at HPP are providing services in a way that we feel is equitable, people are getting the referrals they want, and everyone's getting time with their case manager. These outcomes still persist. So there's a lot more work that needs to be done here in order to try to start mitigating these health disparities for our families.
Awesome. Thank you, Liz. So as you can see, the data and what it reflects, and we are Homeless Prenatal, and we wanted to be intentional about each initiative that we take. And we are very intentional a lot of the times. And I think this time, with our kind of journey and what we're hearing from our staff, we really wanted to focus. We wanted one of the initiatives to be around the Black client experience, the clients that are walking into HPP. What are their experiences? So Black women have the highest maternal mortality rate in the United States. We all know this. In San Francisco alone, of the 10 documented maternal deaths in recent years, 5 were Black mothers. And so because of these disparities, we really wanted to do a deeper dive and look internally, what are our policies, programs, what are we doing? How do we support our clients when they're walking in? So our goal was to work towards closing these disparities for the clients that we're serving. And we want to make sure that when they walk into our doors, they have the best care possible. And if we see in our data review that there's any discrepancies, there's any areas where work needed to happen, we wanted to be intentional about approaching that work. And that's where we are right now. So Liz mentioned a couple of ways that we did the approach, and the focus group was one, and the focus group was really talking to staff, thinking about what are the areas of work that we need to improve. What are the things that are happening for the clients when they walk in that maybe is not providing the best care possible? What are those things? What is your experience, even as a Black person at HPP? And so some of the recommendations that came from that was increasing participation of Black families in our wellness service. And the wellness service is a program that provides a lot of holistic services, groups, classes, connections, creating a space where there's a lot of joy that's facilitated. There's a lot of celebration that happens. There's a lot of support that goes into providing the best care for our families. But we noticed that our Black clients were not heavily attending as other groups were. And so the group recommended that we wanted to be intentional, and we need to be intentional about how we increase services for our Black clients there. Um, More intentional outreach into programming, which was what I just spoke about. So how do we outreach? What do we do? How do we support the clients? What are they needing? Their needs may be a little bit different. So what does it look like to provide intentional outreach and support for the Black clients? Um, and then intentional increasing of representation in the wellness and mental health team. So historically, our wellness team was majority Latinx, and the group felt like having a representation in the services as the providers look like the staff that they're serving, or the clients that they're serving, could be really important. And so how do you do that? We have to be intentional about our staffing and the model for that. And so we have been working really hard in diversifying the not only the programming but also the staffing as well. And they also felt trainings, DIB trainings for staff. Many of our staff come from the community we serve and have varying levels of experiences and expertise, education, and exposure to DEI. And so they felt having a training was crucial, and that is part of our strategies moving forward and having more intentional trainings. And the staff also felt continued data review. We really want to see what the data is saying. Share with us what's happening. We really want to make sure that our families are getting the best care possible, and that we need to be able to see the data. So there's a lot of intentional data review that happens on a regular basis on a lot of the outcomes that we spoke about. Pass to you, Liz.
Thanks, Eden. Yeah, so now that we've shared a little bit about what we learned, we want to move into the actions and initiatives that we have taken. And one of the first things we realized when we started doing this work, and everyone's kind of like raring to go with specific like services they want to provide and who wants to do what, but we realized pretty early on that we can't have specific individuals doing this work, specific people in different specific roles doing this work, or really address this work on a one-on-one level, but we really need leadership buy-in and explicit policies and procedures to set the foundation for any change that we want to happen. So we focused on these agency policy updates first and foremost. And some of the things that we did specifically was we first developed a racial equity statement. And what this is basically a declaration that states our commitment to working toward racial equity. And it helps kind of unite staff under a shared vision of what that means, because it could mean so many things to so many different people. So this was a lengthier process than the one bullet point would leave you to believe, because we really incorporated feedback from all of the staff and tried to land on a statement that like encompassed the work we're trying to doing and that everybody really liked. Once we did that, we had it printed on nice posters. It's posted everywhere in the building so staff and clients can see it and just kind of be reminded of what we're working towards. We also updated HPP's core competencies to include equity mindset as one of those competencies. And the core competencies are a central focus of our performance reviews, which are done annually. They're also connected to performance-based raises, so people are pretty invested in them. And doing this really helped to promote like equity as a value on an organizational level. And it also gives all staff a chance at that annual review to really think about like, how are they doing with this, and where might they need to grow in this competency. We also developed self-care spaces and implemented racial healing days at HPP. We know that this work can be draining, especially for folks who are directly impacted by racism and also involved in direct service work, which is so much emotional labor already. So we wanted to do something that would give staff a chance to like recharge and kind of get ready to be doing this work that we're asking of them. So first was racial healing days, which this is a paid day off that each staff member can take once per month on a day of their choosing. We're really hoping that it reduces the burnout of this type of work in general, and specifically focusing on racial equity, which can be a lot of kind of just emotional labor. And we also built 2 self-care spaces around the agency. And this is just like a quiet, comfortable room for staff to recharge, nice couches, like plants, aromatherapy. So if the work just becomes a lot and folks need to take a break, there is a space that they can go that's not, the crowded office. And then finally, we looked at our compensation structure. This is also a pretty large initiative that impacted all of the staff. Eden was a part of it, as well as some of the other members of HPP. We also utilized a consultant to help with this, felt like it was something we maybe could use an outside view on. And the result of this was that we revamped our compensation structure, made it what we feel is more equitable, and it's completely transparent to staff. Everybody got at least a small raise when we did this, and we just were able to get everybody's compensation more in line with the work that they were doing, which was very positive. So we did all that, and then we felt like we were in a place where we could focus on more client-facing practices. So the first thing we did to kind of address the recommendations from the focus group and some of the gaps we're seeing in the data was develop culturally specific groups and spaces for clients. So the first 2, they both started out as pilots, and now they're like integrated fully into HPP's grouping class schedule. Was an affinity group for Black mothers around kind of wellness in the perinatal period. So this focuses on creating a space where people can come together. It's specifically for Black mothers. It's facilitated by a Black staff member from the wellness team to talk about what is going on in their prenatal and postpartum period, and just get connected with each other. The second is a mental health affinity group. So this group focuses on mental health in the prenatal and postpartum time, as well as attachment with your newborn. Again, specifically for Black mothers, facilitated by a Black staff member of the mental health team. So we've gotten really good feedback and just implemented these into our regular cycle of programming, and are hoping, like, as needs arise, we can use this as a model for what we need to do to make sure that everybody feels welcome to these groups, that they're accessible to everybody, and just meeting the needs that we're seeing. And finally, updating our strategic plan. So we are currently in the strategic planning process, and we really want to ensure that the model that we end up with is one that supports and encourages this equity work. A few things, we're still in it, but a few things that we have already done is we've made updates to our database and started collecting more information that we think we will need around housing and pregnancy to make more equitable and data-driven decisions. So that happened last year, and we're seeing the results of that now, which is pretty exciting. We also have been doing regular data reviews with leadership and staff. So all of the information we've shared with you today, plus much, much more, is all captured on a dashboard that's reviewed with our leadership on a quarterly basis, and then in a presentation with staff at least annually. We've had pretty positive responses to that. Just people just appreciate the transparency and the ability to kind of see like the work that they're putting in reflected back to them. We also adjusted our case management model to put more focus on supporting clients with advocating for themselves during the prenatal and postpartum period. So this was a shift to our model that we felt we had to do first, based on what we're seeing in the data and the feedback everybody is given, and what we want for our clients. So the goal here is to have more advocacy around the prenatal care and around birth plans, more education around especially inductions and C-sections, because we're seeing a lot of our clients get these things scheduled when they're not asking for them, and they might not be medically necessary. We also just want to get people into prenatal care earlier and feeling really safe and respected by their care providers. And overall, the goal is really to improve these health outcomes, and specifically to decrease scheduled inductions and C-sections that are not medically necessary, and increase in positive birth outcomes as well. And then finally, we are dipping our toes into policy advocacy, which is pretty new for us, and which I believe Eden will talk about in a little bit. So I will not talk too much about right now. So we'll go into some challenges and successes of the work. One of the biggest challenges was navigating power dynamics. I think that's one that's probably going to come up for everybody who's doing these work, especially where you have spaces where people are working with staff they don't normally work with, or someone on the executive team, and they don't exactly feel comfortable saying what they mean yet. So this was big for the first, especially few years of the equity task force, just building the trust to navigate these power dynamics effectively. It still happens today when there's new members of the task force. There's always like a little bit of navigation of these dynamics that has to happen. And I think it's making more sense as we practice it, but it has been a challenge. Secondly, competing visions and priorities. There were a lot of ways we could go when we started this work, and everybody had, what they wanted to do and what they felt was important to them. So finding a way to narrow that down to determining like a scope and following one specific plan while also incorporating people's feedback as best we could was very challenging. And I think it's not really until after we were able to do that we saw the work really move forward, and we were able to actually get to the implementation of new policies and practices. And then finally, resources. I think this work also moved forward a lot more when we were able to dedicate time and effort and a little bit of funding towards this work in the equity task force kind of space. But it's always a challenge because this is done on top of our regular work, and it really needs a lot of energy and intention. So resourcing has been a challenge. The successes, this promoted a lot of dialogue, a lot of very honest dialogue that we feel probably would not have come up if we hadn't been able to like facilitate these spaces. So that was really great. I think it led us to having like a more honest conversation about the challenges and the gaps that we're seeing at HPP and how we can address those. It also created new leadership opportunities. We really saw people stepping into the equity task force, folks who, previously we didn't know had been interested in leading those types of things were really stepping in and doing great work. And even outside of the task force, this has just created a lot of new opportunities for people to lean into leadership where they might not have before. It also strengthened representation in senior leadership and across the agency. Eden mentioned that a little bit before. Do you want to speak to that any more about what that looks like in senior leadership, Eden?
Oh, sure. So as I mentioned in the beginning, in 2013 is when we started to really look at our equity work and journey, right? And so prior to 2016, the entire executive team was white. And so that then gave a pause for senior leadership and the board to think about, okay, what do we need to do not only to diversify in terms of representation of identities in the space, but what's needed to be able to do this work right? And do we have the right people in the right positions and places to move the work forward and to lead the agency? And so the board was really committed, senior leadership was really committed to making sure that our senior leadership also mirrors the clients that we serve and the staff that are providing the work. And so it's been an intentional work, and we've made a lot of progress in that front over the last few years. We still have a long way to go, but there was some intentionality in shifting that dynamic.
Mm-hmm. Thanks, Eden. Yeah, I think also seeing that kind of happen over time on the executive team was also really beneficial for the rest of the agency to just see that modeled. Because what's also happened is that teams that historically have been all white or Latinx have been able to kind of see that shift and how it's benefited the work. And as Eden mentioned before, we have a lot more representative staff in general. So not just in the leadership team, but across the agency in the last few years, I think in large part because of that. And then the last one was this genuinely has improved our policies, our processes, and our systems. Just, I think we have stronger practices for doing this work. And it's been hard. It's been years and years in the making. But at the end of it, I think what really keeps it going is everybody's belief in this work, and also just seeing that this makes better policies and practices for everybody, not just one group of clients. But the more we can do this work, the better we're going to serve all of our families and hopefully get to the outcomes we want much quicker.
Awesome. Thanks, Liz. So what's next is that we're going to continue to develop our policies and practices that support racial equity work. We know that if we have policies that are effective, care that is thoughtful, and programming that are strategic, we believe that we can improve the health outcomes of our clients in a positive way. So we're definitely committed to that. We want to continue to evaluate and everyday programming to focus on mitigating disparities in housing and pregnancy. That is a core focus of our work moving forward. And as Liz mentioned about our strategic plan, we just completed it. And so now we are going to be implementing those things. And what came out of the strategic plan is integrated staff support. So majority of our staff are actually come from the community. They either have lived the experience, or they are part of the community. So we really want to make sure that the staff is feeling supported and cared for to be able to do the work. Whole family wellness is one of our other initiatives. So what does it mean to provide service and care, not just for the person that walks into our doors, but the family as a whole? And policy and advocacy and systems. And this is going to be a key part of our initiative. And we have done some policy work and advocacy, and clients go and speak on what's happening. But I think a focus of ours moving forward is specifically around birth equity and family housing agendas. So any policies and advocacy that is needed around those two things, we want to be focusing and providing intentional resources and time. That is it for our presentation. Thank you very much.
Thank you
Any
both,
questions? Yeah.
Eden and Liz. Yes, we have a few questions in the chat.
Okay.
So the first question is, does HPP work with the Black Infant Health Program?
Yeah, we have partnerships, resources, and referrals. Our connection could be stronger, but we do work with Black Infant.
Okay, and the next question is related to the resources you like that were needed to really get this work off the ground. And you mentioned was one of your challenges that funding was needed and staff time could be a challenge. Can you talk a little bit more specifically about what that looked like for HPP and maybe how you navigated that? And yeah, be a little bit more specific because I think that that's a challenge for a lot of organizations. And so,
Mhm. Yeah, it is a challenge, and I think we are still kind of sometimes struggling with it. Um, and but part of our strategic plan moving forward is really being intentional about what is the work we are focusing on moving forward. So, what is our priorities, and how do we resource it? So, it needs to be included in our budget for the year. So, you need to have a person, then we need to hire a person for it. It's a work group like the task force that is an addition to people's work. So what does it mean for folks to get reduced caseload or reduce something to be able to participate in these groups? What does it mean to be doing this other additional thing on top of your thing? So what needs to give in order to complete this? Again, we're still, work in progress, but it is more intentional now than it has ever been before. I don't know, Liz, if you want to add anything to it.
I would also say I wasn't really party to the financial part at this point in time when we started it, but I would also say it did take a lot of communication among program managers and directors because everyone has to believe in this. Like the program managers aren't going to be super happy about someone spending one, a day every other week doing this work if they're not on the same page of where the agency is going. So I think a little bit of that really came like before we had the resources to do it, but just kind of a common understanding among leadership and among program managers and among staff that this is work. So it's not in addition to your regular caseload, but it's like Eden said, maybe with a reduced caseload. And also as far as like the emotional work, the folks who are on the task force on task force days get to leave a little bit early and like go home because it's really, really hard to go from talking about this to like, okay, now I have to go see a client at like 4 p.m. on a Friday. It's really tough. So a lot of that came from just communication and conversations and understanding between like leadership in order to kind of allow for the space for this work while in the background we're kind of working on the funding. It'd be great if we had more resources and more funding to do this still. Like we still don't quite feel it. I think like we have all that we would want to do this work well.
Thank you both for sharing. So another question, can you provide more details of the racial equity mapping that informed this work?
Yeah, so I can jump in and then add in if you want to add
Mhm.
anything. So when we started this work, Relac, the consultant, was really interested in hearing from everybody. So the main way that we gathered information for this was a survey. It's a pretty long survey. It had a lot of different kind of facets of equity work, and every staff member, I think almost every staff member responded to this, basically kind of rated what they thought, how they thought HPP was doing in terms of that work. So the three that we ended up with were the promote healing, distributed leadership, and shared decision making, but there were a lot of other like domains. So we ultimately ended up going with the three that folks felt like were the most important and that we had the most work to do on. So it came through like a very comprehensive like surveying of staff, and then Relac kind of condensed it down to like what the gaps were. And then ultimately all the staff kind of agreed to go in that direction. And I think it was also important that it was independently done. Like it was not done by the leadership of HPP. It was done by this consultant who came in and talked to everybody. I think that was also an integral part of the mapping.
Mhm.
Great. So it looks like I covered all the questions in the chat, but if there are any other questions, feel free. You can unmute yourself and ask directly, or I'll see if any other questions come in over the next minute or so. Um,
I just have a question that I would like to ask, which is, as you think about what's coming up next, is there parts of the work that you or you've heard from staff are most excited about, or things that you want to uplift as you think about what's coming up, knowing that this is can be exhausting and is on top of folks' original work, but also knowing it's important. So curious if any of that has come up in conversations.
Yeah, and this also, the strategic plan was driven by the staff. So there was a lot of opportunities for staff to weigh in about what our strategy and initiatives can look like moving forward for the next 3 to 5 years. And so, because like I mentioned before, a lot of our staff come from the community. And so just like understanding what it means to fully support the staff as they do the work, people are really excited by that. So what are we going to do? How are we going to do that? Um, and I think the whole family wellness is another thing that folks are really excited about because we tend to focus now on the person that walks in, and it's typically the mother. And sometimes we have a lot of dads, but not very intentional programming and resources for them. And the kids, how do they fit into this service? And so there's some excitement around that. Advocacy work is one that a few of our staff are very driven by and very loud about just wanting to be out there and wanting to advocate, especially around housing. Living in San Francisco, it often feels like families are not considered as single adults, and really wanting to be the voice behind for the families feels really crucial. And there's a lot of energy and excitement around that for sure.
Yeah, I think a lot of this work people have been doing independently as staff at HPP because they're really excited about it. And that's great, but it's not really fair. Like they're already doing a full-time job. So I think like a lot of the things Eden talked about, like the whole family care and focusing on fathers and going out and doing the advocacy work, people are really excited about building it into our model so that there's a place for it. And it doesn't just feel like it's them going out and doing this when they have time, but it's something that we are all working towards as an agency. I think they're looking forward to feeling a lot more supported by that. But yeah, I definitely agree with everything Eden said.
Thank you both. Anything else? Any other questions?
Oh, it looks like there's one question that was directed directly to me, and so
Okay.
I'll just read it out. So, are there services only open to people for this community? Like, for example, do you all, Ed and Liz, do you know of any similar organizations or resources that might be available in San Bernardino or other organizations that you partner with across the state that you might be able to recommend to this group?
Like in the East Bay in like Oakland, um, like locally, but not as far as um Los Angeles or anything like that. But I mean, we can try to see, ask our staff and provide that, but I don't know off the top of my head.
Okay, great. Thanks, Eden. Yeah, and to the question too, we can also kind of look through the California Improvement Network and see if there's
Mhm.
recommendations we have as well. So we'll get back to you in the follow-up email.
Great. Well, thank you all so much for joining, and thank you to Ed and Liz for sharing. It's really challenging work, but also hope is it's really inspiring, and I'm really excited to see, what else you all do over at HPP. And I just wanted to remind folks who are on the call that we'll be launching a quick poll. If you could please fill that out before you hop off, we would greatly appreciate it. And we hope that you enjoyed your time through this webinar, and thank you again so much for tuning in.